Well, thanks very much, Tabitha, and thank you everyone for joining me tonight as we look at what's often a very vexing problem that we face, which is what do we do when we get complaints? Why do we get them? And ultimately, what can we do about it so that hopefully we don't actually get as many as what we may otherwise have? And many of you may already know through personal experience or through contact with your colleagues what it can be like to get a complaint from a patient. And I'm not talking about, those really minor things such as, you kept me waiting 5 minutes today. That's not really what we're here to talk about tonight. And clearly we can sort of shrug those sorts of things off. But what happens if something really significant occurs in your practice life and you get a complaint and you really start to worry about it? Because if you do, then it's going to be a bit like this image here of just a whole lot of Lego that seems to have fallen apart all in one sense. And if you're anything like me, and by the sounds of it, Tabitha might be experiencing this sometimes, if your kids leave Lego on the floor and you step on it, you certainly realise that there's Lego on the floor because you've got sore feet for quite a long time. And it can linger for a while to remind you of what's just happened. And often when we get complaints, we face the situation where we start to think, well, what exactly has really happened and what's going to be the outcome? And is this going to really bug me for a long time? Because if it's going to be a real problem for me, how am I going to get out of this okay? And, will I actually come out of it unscathed? And it's a real dilemma because most of us actually aren't used to getting a lot of complaints. We don't have expertise in knowing what to do when we get a complaint. And in one sense, it's a bit like getting a whole bunch of Lego but not having any instructions as to what goes where. How do we put the pieces back together again? Because sometimes it can be really hard to do. And because complaints can be hard to deal with, they can have a really big impact on our lives. Now, sometimes if you get a complaint, a significant complaint, it may be your choice or otherwise that you really don't do anything differently and you just roll with it and come out the other end, hopefully unscathed and intact. And so sometimes some people choose, rightly or wrongly, to make no changes as a result of a complaint. But in my experience working for dental protection now for a number of years and doing a lot of education with them, but also dealing with our members, I do see a lot of situations where people experience a significant loss of confidence in their own ability and their own ability to not only do the clinical dentistry, but also manage the patients and manage their input into a practice. And it can really knock them around for a while, to the extent that some people actually sort of lose their mojo and they don't always really fully recover. And I've known of practitioners who receive a complaint from a regulator and then effectively have a really bad night's sleep for an extended period. I'm talking not just one night, but I'm talking about weeks. They start to lose weight, they're not eating, they may be resorting a bit to a few more glasses of wine and other things to sort of try to cope. They're not getting any exercise and they're sort of really getting worn out and damaged physically from the experience. And that damage can extend to the people around them. And I can think of a particular member whose family really were impacted by this because when they see the main breadwinner of the family actually cutting back on clinical hours and moping around the house and generally feeling bad about things, it really starts to impact on those relationships around them and impacts on the people who you know at the practice as well, who have to pick up the pieces while you're not coping very well. We often hear of situations where our members talk about it being their worst professional experience overall to get a serious complaint. And it really brings into question whether they want to continue doing what they're doing professionally or whether they need to rethink, is this the right job for me? If I stay doing my job, whether as a hygienist or an oral health therapist, or it could be that, they're a dentist or a specialist or a prosthetist, whatever it may be, am I really doing the wrong job? And sometimes they get the push from their employer because the employer doesn't want to have anyone with a complaint that's resulted in a notification and various conditions listed on their registration, which is then in the public domain. Sometimes they decide to leave the practice. They don't trust the environment that they're in anymore. And so it can really have dire implications on your career choices going forwards and also your financial security. And there have been cases of people actually committing suicide as a result of getting a serious complaint where they really don't know what to do. And that's arguably the saddest possible outcome that can arise. So to think of complaints and not think of them as being a serious experience is probably selling them short, because many people really feel all at sea when they are subject to a complaint. And that raises the question then of, well, why is it that people complain? And I guess the first group of reasons I've put on this slide, because I feel that they're often reasonably legitimate reasons why people complain. And the largest one typically is the fact that their expectations haven't been met. Now, that can be for a variety of reasons. You can see that there on the screen. It often relates to money, to be fair. It often relates to just people not getting the sort of experience that they thought it would be. Now, it might be that it just took a whole lot longer than what they thought it would take to get to the end point. And those of you who do Invisalign, for instance, would know that some patients lose their enthusiasm and therefore stop being so compliant part of the way through the course of treatment. So sometimes people think this is going to be easy, it's going to be quick, things are all going to go fine. I'm getting treated for my dental condition by someone with lots of experience. I'm going to be okay. And through no fault of anyone's, it suddenly doesn't work out that way. They can interpret that also as poor service, that often we get patients who think that they can demand access to you just like this, a little click, pick up the phone. They expect you to down tools and fit them in, and that's not realistic. It's not fair. It's pretty ridiculous for most of us most of the time. And yet we do get people where they will complain if they can't get in touch with you on the spur of the moment, or if alternatively, because you're away on leave, you're at a course, it might be just any sort of legitimate situation. They don't get to see you and they're unhappy about seeing someone else. And we do know that a lot of complaints arise from a lack of continuity of care, which I don't have up on the slide, but it does arise from different providers being involved in the patient's course of treatment, because often patients start to ask questions about the next person's opinion about what they've had done before and what's planned. And if they get a different slant on what's been planned, it starts to undermine their confidence in the treatment that they've received to date, and also undermines their perspective on what treatment they may want to take going forwards. And when that happens, we run the very real risk that people like that can actually start to complain because they start to have doubts about the appropriateness of their care. Sometimes we get complaints also from people who just behave quite unprofessionally, and I think that's legitimate cause for complaint. I've known reports of dentists who have just really lost it in front of the patient. They've thrown things around in the surgery, which is not very edifying when that happens. They've been quite abrupt or rude. They may have reciprocated even with swearing when a patient has sworn at them. And that's just inappropriate at the end of the day, and it's unprofessional behaviour. And the problem is, as soon as you lower yourself to that other person's behavioural standard, you run the risk of then actually inviting a complaint that way. So people can complain because their perception is that you haven't behaved in the way that a health professional ought to. Alternatively, though, and this is where we find that a lot of people actually expect this to be the main course of complaint, but it's not always the case as such, that something has actually gone wrong clinically that has now instigated a complaint. And by that, it could be a simple thing that someone's broken an instrument in the patient's mouth. They've, something's been swallowed like a crown or an endodontic file. It could be that a bridge doesn't fit. Could be that when someone's getting perio pocket depth measured, that they find that actually the pocket depth is getting worse. Now, that's not necessarily a misadventure as such, but it may be attributed in patients' eyes as you having not effectively managed their care and causing an adverse outcome of their care. Now, that may or may not be legitimate, but in some situations it actually may be. I know of one dentist who I'm dealing with at the moment who unfortunately prescribe 10 times the correct dose of a sedative for a patient. So that's an order of magnitude error, which happens fairly often, unfortunately, in prescribing. But in a case like that, that led to that patient ending up in intensive care in hospital, and is now a bit debilitated from that experience, has some psychological issues, and that patient has complained, and arguably with legitimate cause to complain. So when we look at these common situations of either someone's expectations not being met or them experiencing genuine episodes of poor service, or sometimes perceived episodes of poor service, or just someone's conduct or behaviour or actual clinical performance being less than ideal, I guess we see that as there being something wrong, that something has gone the wrong way in the patient's journey. And when something goes the wrong way in such a journey, patients may actually be legitimately incited to actually start to take action that way. And one of the ways they take action is simply to start to complain. Alternatively, though, there's another group, I believe, of situations where people complain, and that's where people actually have unrealistic expectations, such as they can come and get a crown done and it will last a lifetime. If they get cleaning of their teeth done and maybe some root planing, and they get given some Pixars and a bit of chlorhexidine mouthwash, that suddenly their periodontal problem will be resolved and remain resolved for life, that there's no need really for any further input on their part. Sometimes, as I was alluding to before, the fact that they can see another provider, not so much because there's been a lack of continuity of care, but simply because that other provider is desperate for business, or is just unduly critical of another person's work, or just decides that they want to take a very competitive or anti-competitive stance, that they will badmouth the work that's been done previously and incite a patient to complain. And in the US, those sorts of situations account for over 50% of dental complaints, from what I understand. And there's certainly a growing proportion of complaints that we deal with. And that may have actually been your experience as well, that everything was fine until your patient went somewhere else, perhaps because you were closed over the Christmas break and have come back with a very different perspective that's been sown as seeds by someone who's been unduly critical of your work. Sometimes patients won't take responsibility for what's happened, and they'll project it onto the person providing their care. So someone with advanced perio who is either going to say that you failed to diagnose it in time, or that you haven't been aggressive enough with the treatment, you should have referred me earlier. And that could just be because they're shocked that they're told this diagnosis after a long time, that they weren't ready for that bad news story. It could be that they've been told that they've got cancer in the mouth, which is a very sad situation when that happens, as we all realise. And they may actually blame those around them, when really many times there's no one to blame. It's just bad luck. It can be a lot of factors that they may have actually caused themselves to be susceptible from, such as substance abuse. But they like to project that onto others who are convenient targets for that. So people will complain simply because they hear bad news. They may also complain because they have a real intention to try to make some money. And often we expect that people are motivated by greed and by vexatious intent. It can be true in certain fields. Hopefully your patients trust you enough that they wouldn't feel encouraged to do that. We are convenient targets at times, and we saw during the start of COVID actually that there were actually an increase in complaints that I was dealing with at the time, surprisingly, because often practice was quite quiet. And one of the suggested reasons for that has been that people were down on money. They weren't earning as much income. They were on JobKeeper if they were lucky. And now they thought, dentists and hygienists, oral health therapists, dental therapists, prosthetists, whoever that they may be, are rich. Therefore, let's go and get some money out of them. Let's complain about something that's happened. And they can try to punish you simply because they think that they can. It's obviously not a very fair situation to be in, but they sometimes think that you're successful Therefore, let's just knock you down a few pegs that way. So that's by no means an exhaustive list of why people complain, but it does raise that whole issue then of, what's really going on in your patient's mind? Do you understand what your patient is really thinking? Do you know your patient well enough to know whether they're happy or not? When do you check in with them periodically to understand how they feel their course of treatment is going? Because I think we tend to assume that patients must be happy with what we're doing, because if they don't complain, they're happy. But a lot of people don't complain. A lot of people just don't come back, or they come back sporadically, or they're quietly simmering behind their own mask while you've got your surgical mask on. They're wearing a mask of apparent contentment, or perhaps even just ambivalence. But deep down, there are areas that they're thinking that they're really unhappy about. They don't always know how to approach it. Perhaps they're waiting for something bigger to happen so that they really feel confident enough to complain. So what are you going to do to check in with your patients periodically to try to understand how they feel their treatment's going? Is there anything they have any questions about? Are they sure that they're happy with everything? Do we need to take a breather or rethink how things are travelling if it's a long treatment plan, so that our patients don't actually get burnt out with their treatment and then complain? So have a think about what's going on in your patient's mind, because unless you ask them, they may not volunteer what's going on. And in a case like that, they may jump to conclusions and make assumptions about what you're doing for them. And that may not be realistic nor relevant to their true type of treatment that they're receiving that way. So I do encourage you to start to really think again about, is there something more I can do? If you don't, and you just let things take their course, then you may find that you get one or more different types of complaints that come onto your doorstep. And we're all familiar with things like oral complaints. So, and I'll give you some examples in a moment. But you could also get an email or a letter sent to you, and that's usually a lot more formal and often a lot more confronting in a sense, because you'll read it and read it and read it and try to understand what it is the patient's saying. They'll usually use the terminology wrongly. It won't be terribly well written, and it will be quite emotive. And it's confronting getting a very emotive complaint from a patient. And if you've ever had one, you'll know what I'm talking about, because it distorts the truth a lot, quite often, what the clinical facts are. And you're getting an insight into what they're thinking, but it's not really helpful always to get that, because there's a lot of things that you don't agree with. Many of you use a lot of social media, and it can be very confronting as well as disappointing to read that someone is complaining about their recent experiences at your hands or at your practice in social media, rather than actually talking to you first about it. And it's very difficult to respond to that, to the extent that often you can't really comment safely and legally about that, because to comment on the treatment of your provided patient in the public domain is typically considered to be inappropriate and could result in a sanction. So you need to make sure that you don't respond in an argumentative way, but invite them to come and talk to you at the practice to discuss their concerns in a constructive way, but do it in a way that doesn't look like you're being particularly defensive or reactive in that way, and that can be easier said than done. So these days we're seeing many more complaints in social media as the first opportunity that you get to be aware that someone's actually unhappy. They haven't bothered to tell you, they just want to tell the whole world. And it's very difficult to get those removed. And it's very difficult to give your side of the story that way. So that's actually one of the worst case scenarios to be in, when you're partly gagged in what you can say, and you're stuck with thinking, how do I defend myself and my reputation against this? You can get the patients who, as I said a few minutes ago, just really don't cooperate very well with you. And that's their form of sort of passive-aggressive behaviour to complain, in a sense, where they're very late in payment, or they don't keep their appointments, they cancel all the time. You start to see some damage to different types of things that shouldn't be happening. Other times we get letters where it's a letter from a lawyer, maybe one of the ambulance chaser lawyer firms that you'd all hear on the radio or TV, or it could be from a reputable one, but they say, I'm acting on behalf of John Smith, and I have his signed authority to release all his clinical records, and I expect this to be provided to me within 28 days. And suddenly you think, well, that's not exactly a complaint. It's an indication that your patient is genuinely unhappy about something. It may not be always to do with your treatment, it may be with another provider's treatment, but there is something going on here, and that complaint may spill over into your domain. So when that arises, it can be worth your while to consult your professional indemnity association just to see whether you need to be particularly wary of that. And unfortunately, more and more people seem to be getting exposed to AHPRA notifications, and I'm going to talk about that in a few minutes because they can be quite scary, and they can certainly knock you around if you're not prepared for them, and it's very hard to be prepared for something like that, to be fair. I always tell the members who I deal with that if you think that you're very experienced at knowing how to deal with an AHPRA notification that way, I'm a bit concerned, because that means you've got a bit of a track record, and it's not the sort of track record you really want to have. So I don't know if you can see this, because I don't know where my image is showing up on the screen, but if someone says, no one ever told me I was going to lose all my teeth for whatever reason, whether it was usually perio, could be because of rampant caries, they will start to complain and blame someone when you and I know if it's perio, it's, an autoimmune and infective reaction to their oral health situation by and large. If it's caries, it's often diet and hygiene based as some primary drivers of that. And a lot of those factors are outside of your control. And yet to say that they weren't aware of something is probably a bit disingenuous, and yet in their mind, that's what they believe. Similarly, we can have situations, sorry, I'll just go back, where I don't know if you can see that there, where it just says, do you have any idea what it's like to now try to apply lipstick but only feel what you're doing on half your mouth because a patient's got a paresthesia after having had an implant placed typically these days, or they've had some third molar surgery and it started off being a bit tingly post-operatively and it hasn't really totally resolved. And obviously the simple answer to that is, well, no, I don't know what it's like to experience that unless I also have a paresthesia. And so, this is a real problem because this patient may very well be debilitated that way for life. And in a similar way, you can have either orthodontic issues. I've had a case, I'm just trying to hide this top part of my screen there and it doesn't want to go away, unfortunately, that, we've had cases where a dentist has started ortho on a patient and for whatever reason is unable to continue that ortho and tries to do the handover. But that hasn't happened for whatever reason. And so as a result of that, we find that the patient now feels quite abandoned, or the parents of the patient feel abandoned and they start to complain. And they see it as being on their head to actually try to organise things, because sometimes the practice isn't prepared to actually organise for the handover to occur. We've had patients who have had simple things such as an MO restoration on a lower 6 or lower 7 done and then ended up with some really serious trismus. And, they've been stuck with jaw pain for weeks and or months. And they say things such as what you see on the screen there. If I'd known this was going to happen, I would never have consented to getting that filling done. So what do you say to those people, and how do you deal with a complaint like that? Because, you weren't expecting that either. If that happened at your hands, it's certainly not something that anyone actually, aims to try to have happen. Or I'm dealing with a complaint this week where the gentleman who's an elderly gentleman has said, you made me a denture, I couldn't wear it. And so I agreed to have an implant placed because it's only a single tooth denture and I can't function on that implant either. So what sort of dentist are you? And, I want not only my money back, I want my money back plus some extra money to compensate me for all the aggravation you put me through. So you don't want to hear that. You've invested hundreds and hundreds and hundreds, sometimes thousands of dollars worth of resources into lab fees and implant componentry, or whatever the case may be, lots and lots of clinical time, and yet this is the sort of thanks that you're getting from your patients. So we don't want to see that happening that way. And so what are you going to do in these situations? Well, what we do know from AHPRA statistics is that this is the overall AHPRA statistics from the 2019 to 2020 calendar year for all health professionals. I wanted to show you this to give you some context as to how likely it is that people in oral health are going to experience a notification, because right across the country, across all healthcare workers, there are a bit over 10,000 notifications. And these notifications are when a patient or another party actually makes a formal notice to AHPRA complaining about the performance or behaviour of a clinician or some healthcare worker that way who has registration with AHPRA. So that represented roughly 1.7%, 1.6, 1.7% of all registrants for AHPRA that way in that period. And when we start to look at what happens from Dental Board of Australia statistics in the same period, only 784 notifications occurred. So that's less than 10% of that total number, which is great. But it did strike about 1,000 registered dental practitioners. And that means that out of about 24,000 registered dental practitioners overall, it was roughly 4% of the profession who had a notification. Now, if you look at the maths there, you're going to automatically say to me, well, that doesn't add up. How can there be 784 notifications with 1,000 practitioners? And I think that's because some of those notifications involve multiple practitioners in a practice, or various practitioners across a course of a patient's care across multiple practices. So they've been to see Dr. A and had some work done, and they've gone to see Dr. B, and then they've seen hygienist C. And what's happened is that because there's been an overall adverse outcome from the experience, they're actually complaining about all three. So when you think about it, 4% of the profession versus 1.7 is a bit higher in dentistry. And all other things being equal, and I know you don't really interpret statistics quite this way, but if 4% experience it and it's different 4% every time, then by looking at the law of averages, you would tend to argue that once every 25 years, you'd sort of expect that you might get a notification from AHPRA in your clinical career. So that's going to be roughly twice, maybe a little bit more, but roughly twice in your clinical lifetime that you'd expect to get an AHPRA complaint if all other things being equal. Now, that won't necessarily be true, because there are some people who get more than one complaint and others who never get a complaint. But to give some perspective around that, don't be surprised in a sense if during some time in your career you do get a notification made about something that you've done with AHPRA. Now, I really want to emphasise here that if you do get a complaint, it's not necessarily because you've done something wrong, but in the eyes of the person reporting the incident, they believe that it is necessary to make that complaint. But it may not be true that there's any grounds for that. But as you can see there, basically half of those notifications come from patients or someone very close to them. 30%, or roughly a third, come from what we call the health complaints entities, and they're the state-based regulators. So here in New South Wales, where I am, that's typically going to be the HCCC, the Healthcare Complaints Commission. So they will refer complaints made to them onto the Dental Board, and the Dental Board in New South Wales is represented by Dental Council of New South Wales, but the way it's described in different states does vary. What I'm trying to really point out here is that roughly 80% or so of complaints either come because someone complains directly to AHPRA or to another regulatory authority, who then complain to AHPRA on their behalf. And there is, though, roughly 10% coming from either your employer or another practitioner who could effectively be an employer anyway. So we're now seeing that, you know, a reasonably significant proportion of complaints to AHPRA are arising from people within the profession or very closely tied to the profession who are then initiating those sorts of complaints. And the problem with getting a complaint from AHPRA is that it often can take weeks or months to get resolved. And that's where you start to lose your confidence, and that's where you start to doubt yourself. And it really can knock you around, and it can involve a significant amount of time being spent either being interviewed or trying to write letters to justify what you did on a patient and why you did it. So that's all very challenging that way. I've just took this screenshot, so I apologise that it's a bit blurry, but you'd probably want to know, well, what are those complaints about to AHPRA? And roughly 2/3 are about clinical care. And then there's a whole lot of other issues to do with communication and a variety of other things that all get bundled into that 24% that they don't really give us a lot of visibility about. So I think suffice to say that it's more often than not a clinical matter that triggers an AHPRA complaint, but it's not necessarily one. And there are times when there can be complaints being raised to do with suggestions that you're impaired in another way other than your health. It could be that you, are alcoholic. It could be that there's been sexual misconduct or allegations of that with patients. So they're reasonably common, unfortunately. It may be substance abuse, self-prescription of medicaments, those sorts of things. So whatever it is, it can have some pretty serious consequences. So, one of those consequences is that they may actually put conditions on your registration, which may involve you having to undertake a course of education or having a mentor appointed to talk with you on a periodic basis until such time that they feel that you don't need it anymore. Maybe that you need to be supervised in your clinical practice. That may not mean having someone physically in the room, but it may very well mean that you have to discuss cases with another registrant who's been approved by the board before you can actually be allowed to practice that way. So that's problematic, actually, and really quite difficult, can be quite expensive. They can restrict your practice or just totally suspend you. The restrictions say if you were doing ortho and there's been a major incident that they feel they're not confident to think that your knowledge of ortho is sufficient, they may say you're no longer allowed to do ortho for a period of perhaps 2 years while you're undertaking further education. That can have a real impact on your viability that way. They may choose to suspend you if it's something serious. In cases of people being suspended from practice for such things as not complying with COVID regulations and as a result getting a criminal conduct charge. And if that's the case, then they are no longer able to work. Usually AHPRA will step in. And there can be other external entities, as I've listed there on the screen, who can actually then have to take something on. So if you've done something that is, say, sexual misconduct, then it may very well be referred to the police. And so not only will AHPRA deal with it, but it may become a police matter. Alternatively, there may be no action at all, and it may just be dismissed that way, which is obviously the best possible outcome, but you can't be guaranteed that that's going to be the case. So I guess the question then remains, well, are complaints bad? Because, we sort of assume that they are bad. Sorry, this isn't working quite how I wanted to do. And complaints often are bad if they're describing some lapse in quality. They take their toll, which I've talked to you about already, and they often can be costly and time-consuming to resolve. So if your patient's got a significant problem and it's not resolved, then we run the very real risk that it's going to cost thousands of dollars to resolve it and or lots of time, lots of liaison between different practitioners to try to resolve that, and that can be difficult. Yes, you can get that regulatory action taking place. Sometimes you get legal action when you get those legal letters involved, and that's very upsetting and disconcerting. It very seldom involves a court appearance, which is good. It very often, if it's a legal action, results in 5 or 6 figure payouts, and they can take many months and often years to resolve. Perhaps the worst case scenario from complaints, though, is just the fact that they cause that reputational risk, and they damage the practice, and they damage your status in front of your colleagues, and it can persist for a long time. So you don't want to really experience that. So complaints have a lot of significant consequences besides just that direct personal impact that I talked about at the start. But I guess the question is, are they always bad? If you get the light bulb moment taking place in one of your darkest moments when this happens, maybe it actually raises your awareness that no, they're not. Maybe sometimes they actually can be a good thing, because they help you to identify where there's areas of weaknesses in what you do in your clinical practice, and also what you're really good at, what you never get complaints about. Helps you understand that usually you must be pretty good at it. It's not always guaranteed that that's true. They can often give you an opportunity to fix a problem or reduce the severity of a problem before it really spirals out of control. So sometimes a complaint is just that trigger that reminds you that things are starting to slip before any real harm takes place. So complaints can actually be a good thing to act as a reality check for you and remind you that you can't become complacent, or you may need to continue to train your staff or restructure how you run your practice that way. It may actually cause you not only to identify your strengths and weaknesses, but then decide, I'm actually going to not do a particular type of treatment from now on, or I'm not going to work at a particular practice anymore because the way that practice was run really set me up to fail, that I didn't fit very well at that practice, that the support that they gave me was poor, they booked patients in too tightly, things just didn't run very smoothly, and that weakened my ability to perform to a professional level. And it can certainly be a very salient reminder that you need to lift your game, that there are areas of your professional life where you're lacking. And if that's the case, then it's like a lamp being turned on and reminding you, this is what you really need to do differently. Start doing it now. Fix it while you can, and that'd be really good. And they're also not always bad, because if they do prompt you to rethink and re-educate yourself and make yourself more capable as a clinician, that's going to set you up hopefully for a lot more success later on. They can give you an opportunity actually to build some really profound bridges with your patients, because there are times when you have a complaint. If you actually work hard to resolve it constructively, sometimes those patients really value the fact that you took them seriously, you listened to them, you fixed the problem, and they actually turn it around and become very loyal and refer you patients. So we've seen that happen on a number of occasions where they see a human side to you, you see the human, not just the sort of professional patient role of them. And as a result of that experience, you both grow stronger and sometimes closer as a result. It's a pretty tough lesson to learn to get to that point. But, it can help you. And as I was sort of alluding to a moment ago, sometimes by rethinking what you're doing, you might be chasing that three-pointed star in the driveway. But maybe it just reminds you that that's not only what life's about, that there are other things that are important in your career, and that, maybe that aspiration isn't the right thing after all for you, or that you can do without that and have a different badge or a different outcome. Maybe you can make do with less money. Maybe you can get a job that gives you more flexibility. Whatever the case may be, if you gain insight as to what's really important to you in your career, then from experiencing a complaint, and that changes your trajectory and what you do for the better, then it's actually been beneficial for you rather than detrimental to, your overall well-being. So I liken that whole situation then to this, because I saw this and I thought I'd share it with you. You may have seen it before, in which case, forgive me. But I like it when it says no sand, no pearl, because it sort of reminds me of the fact that sometimes you need that adverse situation or event to be a trigger for something beautiful to come out down the track. It's not always something that's going to come out straight away. And if you expect to see major change immediately, you may be fooling yourself. But if you can manage to get that to change nicely that way, then you're going to possibly be better off for it long term. So I like to think that complaints aren't always bad, and that there can be great things that come from them in the right hands. Often when you get a complaint, when we talk about what you're going to do about them, you're going to say sorry. And you're allowed to say sorry. And in just about all jurisdictions, if you say sorry, that's not an automatic admission of liability. It doesn't compromise you medico-legally. So, saying sorry is okay and can be a really constructive tactic initially, because patients nearly always, if they feel wronged, will benefit from being told that you're sorry, provided you're genuine about it and you actually come across as being sincere. So saying sorry is good by and large. Saying sorry and then taking full responsibility may not be medico-legally sound, I might add. So by all means say sorry, but don't say, I'm sorry, I'm totally to blame, I'll do anything to fix it. That may not be what you ought to be doing, and that certainly wouldn't normally be my advice. But besides wanting an apology, what are the other reasons why people complain? Because we know that they're unhappy about something, but what are they expecting then as the outcome? And besides the apology, I think that they often want much better understanding as to why it happened to them. Was there something that needs to be fixed? Is there a particular reason why this had to happen to me? So they want an explanation, and they want some insight as to why they're in this predicament now, whatever that may be. Why is it that I'm going to lose most of my teeth? And, and why is it that I've been coming now for 3 years and I'm still going to lose most of my teeth, despite every 3 to 4 months going through a lot of uncomfortable scaling and root planing? So whatever that may be, they need some insight. They often want to hold the person who's been managing their care accountable, and if necessary, punish them sometimes, as I said. They want to stop it happening to other people. And they might see you, as I've said before, that they think that money grows on trees. And so they may be seeking some sort of financial compensation for pain and suffering and their economic loss if they've been unwell and they've had to take time off work. And there is an element out there that I'm sure you're aware of, where there are some people who just sort of say, look, I can complain, so why not? Yeah, maybe I'll get something out of it, even if it's not really grounds. It's not going to cost me anything to complain. And I might get something out of it. They might just throw some money at me to shut me up. So I might come out of this okay. I've got no loyalty to this person, so why not? So sometimes they're just after try it on and sort of see how it goes that way, sort of situation. The reason why I sort of repeat this slide is that, saying sorry without putting some context around why it went wrong is a bit like saying, sorry, you're closed. But I'm not saying that's because we're locked down because of COVID or something like that, in which case people tend to be more understanding. So it's helpful if you can share information with a patient and spend some time with them to put some context around why it is that they're unhappy, whether it's really legitimate that they should be unhappy, and what you can do about it. So I've got this slide here to try to talk you through just at a high level about typically how a complaint would normally be managed. Now, this is not absolutely prescriptive, but as a general rule, we'll say if you get a complaint of whatever type, it's actually really helpful if you can acknowledge it promptly, usually within a day or two, and to actually say thank you for letting me know of your dissatisfaction with your care, because that patient, believe it or not, is doing you a bit of a favour by telling you about their discontent. If they just bottled it up or left you or put it on social media directly without approaching you, for instance, that's a problem, a much bigger problem. And try not to be defensive about it that way either. Tell them that it's going to take some time to look into it, and that way you can consult your records and talk to any staff who may have been involved, and try to understand, after doing some sort of overview and investigation, as to what has actually happened that's been documented. Are there any real grounds for why this person should be unhappy? And then if you have any doubts, seek some advice from people like us here at Dental Protection, because or otherwise your professional association, it's helpful to talk through what the story is. Sometimes you don't see it because you're too close to it, and you need the insight and the perspective of an outsider to help you understand what's really going on here. What is the real root cause of this problem, of this complaint? Is it as simple as what the patient's describing? Is it something deeper seated than that? And then often you'll need to come up with some sort of response to explain what happened and why, and what might be able to be done to fix the problem. And so having that clear in your mind is really important before you meet with the patient. There's no point stumbling through and, I think we might be able to do this, that, or the other. That doesn't inspire confidence at all. And if you don't understand what's gone wrong, it's very hard to know how you can fix something. Sometimes you can fix things immediately. If there's been an infection control breach, you have to fix it immediately. And if there's been a complaint arising from that, obviously, or if there's issues to do with, the wrong patient being treated, the wrong John Smith getting the reminder letter sent out to them or something, you've got to fix that. And so that can be fixed quickly, but others may take some time and a lot more effort. So you need to come up with, well, what are you going to need to do, and be clear about what that's going to involve, both for the individual and maybe for your systems and the way the practice is run. And then you can meet with your patient, or either online or in person or over the phone. Generally, the face-to-face is considered superior unless that patient is aggressive or lives a long way away or refuses to meet that way. You pick up a lot more body language that way, and you'll meet with the patient. If the complaint is via a regulator, you may end up having to meet with the regulator and talk to them about things. But if you've done your homework prior to that, then those meetings can be constructive and instructive. And so that can be really helpful that way, because that way you can start to try to resolve where the conflict exists, provide an explanation, decide what it is that you're prepared to do and what you're not prepared to do, defend what happened where necessary, and then see if it can be resolved that way to the benefit of both parties. And then the final step, of course, is all your prevention, which we all understand very well. But if you don't learn from a complaint, then it's been a bit of a disaster usually. Whereas, as I said, if you gain insight from it and things are better as a result of that complaint, then it hasn't been wasted, and it may actually have done you a favour overall. So sometimes that involves individual learning and change. Sometimes that involves organisational learning and change, and it may involve both. Sometimes the complaint that you experience is directly relevant to all your colleagues in the practice, and so actually sharing your experience with them may help them prevent experiencing a complaint in the future. So you don't have to feel so isolated if you can share that experience and share the learning from it, so that others can benefit from your experience as well. Part of that sharing is to sort of understand what happened and why. So you can ask the question, well, why did this happen to me? Was it always going to happen to me, or could it have actually happened to anyone? Am I looking at this all the wrong way? Do I need to rethink what is happening so that I understand things more from my patient's perspective? And if my patients seem to have unrealistic expectations about their perio, their ortho, their oral surgery, whatever it is, how am I going to change that? What am I going to do to re-educate them so that we reset their expectations to be more realistic next time? If you don't under-promise and over-deliver, you set yourself up to fail, because if you over-promise and under-deliver, then people's expectations aren't met. But if you say, look, I think this is going to be like this, if it's perio, you say, look, we're hoping that we might be able to stabilise, or slow down the rate of attachment loss over time and reduce the amount of bleeding and halitosis and all the other things that you are experiencing. And then if you actually find there's a little bit of attachment gain sometimes, or if there's no further attachment loss and the patient responds really well, then that patient will be quite stoked usually. So do you actually communicate the alternative action if you at first don't succeed? So have a think about, are your patients clear about what will happen if this treatment doesn't work? Will they need referral to a periodontist or to an orthodontist or to someone else? So if you don't tell them, they will expect it to work. If you tell them that, look, if this doesn't work, I'm going to have to send you somewhere, or we're going to have to do this again, or we're going to have to do whatever it is that we have to do. It sounds much less like an excuse and much more like a detailed explanation, and you're presetting their expectations that way. Ask yourself also, what don't I get complaints about? Where do people seem to like me? It's helpful that you keep a balanced perspective on this too. So after a period of reflection, one of the things you're going to do about it is to reconsider how you document the patient's journey, because you really need to document ideally what it is the patient wants from their treatment, what their goals and priorities are in their care, and have that down so that you're clear about them. And if the patient's not clear, you need to ask them what that is. You need some formal consent process for a lot of treatment. Now, that may be financial consent, which I've got there as a point. It may be clinical consent, it may be both, depending upon what's going to be involved. But the process needs some documentation in the notes and maybe with forms, but not always in forms. But you certainly need what's consented documented in the clinical record. And it needs to reflect the process that's been undertaken, not just consent to X, whatever that is, but what was the information that was shared, what was agreed, what was some of the concerns around that, what are the timeframes, the costs, all those sorts of things. So that way your clinical record tells the full story of the patient journey up to that point as to what's been agreed and also where you're going to go from there. And think about in your documentation whether you can factor in what I call FAT. That's not to offend anyone, but it's just to say that, if your appointment book is too tight, you can never get someone in, that's where you're going to encounter some problems. Or if you're running late all the time because things are too booked in, then you're going to incite more complaints. So if you can factor in as part of how you structure and document all the records, you allow a bit of catch-up time, emergency slots, all of those things. If you factor in some extra cost, if it's an endo case, and most of you might not be doing endo, but I guess what I'm trying to say is if you factor in a quote for 4 canals and there ends up being 3 on a molar, well, that's a benefit for the patient because they don't, and it doesn't cost them as much as what they had thought it might. But if you only quote 3 and it ends up with 4, they're going to be unhappy. So again, your documentation, if you can try to create an understanding of what a worst case scenario is going to be, and then if it's better, that's better for everyone, and document it well, then you're in a much better place. And ask yourself the story, well, should I be doing this treatment right now? Is it appropriate for a patient to go into restorative treatment while they've got periodontal problems that don't seem to be well managed? They may be losing a bit of patience, but is this going to be the weak link in the future care unless I fix this? Do I really want to treat this patient? Because, sometimes we think we can do this and get away with it, and I'll be really proud if I can pull this one off, which is great if you do, but what if you don't? And so ask yourself the question, should I really be doing this or should I be referring the patient? Also ask, is this really the right thing to do? I've had members who have decided, say, to start ortho treatment while there's still a bit of perio and restorative that needs to be done, under pressure from a patient, and then later on had a complaint from the patient, which is really unfair because they're trying to appease the patient. But you and I know that you don't do that normally until all the preventive and sort of basic treatment, in a sense, is being sorted so the patient's stable and clinically sound before you embark on the complex treatment. And, if any of you are doing procedures, whether it's bleaching or whether it's, doing ortho adjustments or other sorts of things, some people are getting into a whole lot of aligner therapy. I've got no barrier to push against that specifically. I just make mention that it is an area where people come unstuck. So we need to be really careful with those sorts of tasks. Is it really necessary for you to do high-risk procedures because all your friends are? Or do you just avoid that because they are often the source of a lot of complaints? And make plans to ask, should I get my practice reviewed? Do I need fresh eyes to look at things? Do I need to make sure that I pay my professional indemnity before the end of June? Because if I don't have indemnity, I've actually breached my registration. Do I back up my IT system so that way if we do have a crash, I can look at the radiographs, I do know who's coming in. Am I doing my CPD requirements? Well, you are if you're here because you're going to get an hour's worth of points. Where are the weaknesses in the practice? Am I using social media in a wise way or not? And am I encouraging to the opportunities that may arise from receiving feedback? So, is this something that I welcome so that I can improve and change? Or am I only open to positive feedback and never to negative feedback? So, you really want to consider, are there other ways that you can manage the risk of complaints more constructively? Because if you start to address these things by being on the front foot, you'll reduce your risk of complaints at the back end. And if you do get a complaint, they're likely to be a lot less serious than what they'd otherwise be. So with all that in mind, don't forget that if you are a dental protection member, we're here to help you. We provide all of the support that you can see there on the screen. We're happy to try to have your back when things start to go wrong. If you do get a complaint, by all means, let us know about it so that we can assist you. If you're not a dental protection member, then I do encourage you to approach your own professional indemnity insurer and talk to them about whether they're able to support you during a very, very difficult time. Because our goal at Dental Protection is to try to help you learn from these experiences and avoid them in the future. And often if you start discussing it early, you can get through it well. We can also provide you with counselling if you're not coping very well and advise you on what to do differently going forwards. So look, thank you very much for your attention this evening. I believe